Phase 2, activation and treatment of the torso and spine. And I will go through also the class cups treatments. So when you work with the class cups, don't hold the big bells like this, but from the bell. Because if the class cup falls down on the floor, it might break down. When you insert the small class cup, don't push it too hard because it will go inside here and the suction will also suck it even deeper into the tissue. And we start now the activation once again with the pulsation mode and with the subclavicular fossa, which you can also activate from here, from trapezius muscle. And after the activation, you start going the spine from the middle, 2-3 pulsations on one spot and then the next one. If you want to, while it's doing the suction, you can also start lifting and twisting the tissue up and down, or you can just lift it up and down. You go all the way down to the sacrum area and you come up. When you take the pulsation away, you can start working more actively with the second technique, lifting and twisting and adjusting the pressure to the tolerable level on the skin. Up and down. And when you want to release the cup, you just press your finger just next to the cup edge and twist the cup to the side and it comes off nicely from the skin. You also might want to work with the mode that you pull and push and work with the other hand and with the muscles on different directions. Or the hands on the opposite side. The sacrum area you should always treat very well with a lift and twist technique. If you want to work with the smaller class cups, you should always press the little hole on the side to close the airflow, and the small little cups are good, for example, for hand treatments or for facial small treatment areas. When you work with a double cup, we have a double cup hose and you will insert 2 class bells and once again you regulate the pressure according to the tolerable level, and you can start lifting, twisting up and down. Also you can do a circular movements if you want to. If you want to do the gliding, then once again you regulate the pressure so that you have the pressure, and then you can start going, for example, even with the 2 bells, 2 cups simultaneously. Or you can just with the other hand and with the other cup you can pull the skin nice and tight and work with one hand. So I'm directing here on the upper torso towards the armpit or towards the subclavicular fossa area, the lower watershed line towards the hip and groin area. And on the opposite side. You may also do the back spine if you want to. You may also go over the spine. And once again, the treatment will be ending with the pulsation mode with approximately about 1 second on the subclavicular fossa. And now with the dual function hose, you can do the both sides simultaneously. If you want to, you can also work on the back with the roller cup. You just have to change the plastic cup hose, or if you have even two roller cups, the small and the big one, you can work simultaneously with two roller cups. You just regulate the pressure to the tolerable level, and then you can start working. With the dual hose function. Also, the roller cups have the same motion, so you can also do the pulsation mode with the roller cup as well if you hold them in one spot. Then after this we would do the taping of the back. And now we will do the taping of the back, and this is one possible taping example. Remember to shave if it's needed. Clean up the area that you want to tape. And then you will cut the needed amount of tape. Remember to round the edges of the tape so they won't get caught by dressing up or with the clothes. So we put 3 in here, and then we will use also one activation tape here on the trapezius. You cut the tape between the handles. Apply the tape with no stretching. So now if there would be, for example, a neck problem, so this would work on top of the trapezius as well as an activation tape for the subclavicular fossa area. So if you put this one, you don't need 1 or 2 handles here in the subclavicular fossa. No stretching for the tape. As you can see, it stretches only between the handles. You remove the back paper, the endings. First softly and then more firmly from the middle towards the ends. And then I put 5 pieces, 5 handles here on the lower back. And once again, no stretching. Starting from the middle. First softly and then more firmly into the skin. And then once again the protocol would be, when you start working with the back tapes is 20 times here in the subclavicular fossa area, 20 activations up and down. So this is the activation. And then you start working with the back. And now of course we would have waited for 20 minutes so that the adhesive really sticks and goes into the skin. And then you start moving up and down, pulling, twisting. And you should never pull so much that the tape comes off or creates any pain. And then you work around 5 minutes. Of course, for the back you would need another person to work and twist and pull and push the tapes. And then especially when you start going down, you also work with different fascia layers and different muscle structures. Especially when going down, remember with the pain tolerance that you would not create any pain. And then you can finish up by pulling and then ending the treatment with the final activation here to the subclavicular fossa area for 20 times. So this was one example of the back taping, and of course you can do your own solutions which you think that are good for the back problems.